Hello, my name is Jeanette Blanco, and our biology topic will go over genetic diseases and disorders. I will be discussing sickle cell disease. Sickle cell disease is the most common inherited blood disorder in the United States. It is characterized by a mutation in the hemoglobin beta gene found in chromosome 11. Hemoglobin is very important to the body because it transports oxygen from the lungs to the rest of the body. Red blood cells with normal hemoglobin molecules are round and smooth, as we can see here, and travel smoothly through the vessels. However, people with sickle cell disease have abnormal hemoglobin molecules, which cause the cells to stick together, causing blockages in the vessels. This could be very dangerous to the human because it could cause damages to vital organs and tissues. These sickle cells are very harmful, thus, they are destroyed rapidly by the body. This can cause sickle cell disease, sickle cell anemia. In past history, people diagnosed with sickle cell disease were not known to survive past childhood. However, with medical advancements and preventative treatments, about half of the patients with sickle cell disease can live up to 50 years or more. Treatments for this include antibiotics, pain management, and blood transfusions. There is only one known cure for sickle cell disease, which is bone marrow transplantation. However, it is known to be very risky with many complications, and there's only an 18% chance that you will find a matching donor. My name is Jeanette Blanco, and this is my presentation on sickle cell disease. Thank you.
Hello, my name is Nayeli Diaz Fuentes, and today I'm going to be telling you about cystic fibrosis. So, what cystic fibrosis is, it's a hereditary disease that affects the lungs and the digestive system. The body produces this thick and sticky mucus that often clogs the lungs and even obstructs the pancreas. So, here's a visual. What you're going to see here are what are called CFTR proteins, which is short for cystic fibrosis transmembrane regulator proteins. And these are going to lie on the surface of the cell, these proteins, and these cells lie on the lining of the digestive system, the lungs, and the sweat glands. And these are essentially responsible for the passage of water and salt going in and out of the cell. So as you can see here, in a normal protein, you have these chloride ions going in and out of the cell. But with someone with cystic fibrosis, you have this mucus right here building up on these proteins, which obstructs the passage of this water or chloride ions, whatever it may be, going in and out of the cell. So that's what they're going to have. And with someone with cystic fibrosis, these proteins, either they're not going to have enough on the surface of the cell, or they're just not going to be functioning properly. So with cystic fibrosis, it is not curable, but it is treatable. So treatments can often ease symptoms such as delayed growth, abdominal pain, and chronic cough, depending on the person, their age, and things like that.
My name is John Michael Lopez. I'm going to be discussing breast cancer. Breast cancer is a type of cancer that begins in the breast, where cells take on rapid growth, usually forming a tumor. Breast cancer happens in 4 stages. Stage 1, where the tumor size does not exceed 2 centimeters and has not yet spread outside the breast. Stage 2 describes when cancer is still contained but is growing larger. Stage 3 is when the cancer cells have spread further into the breast or the tumor has gotten even larger. The cancer may have spread to the chest wall, possibly even the skin, or even damage the skin at this point. The tumor may not even be present, but cancer has reached about 10 lymph nodes in the chest wall. Stage 4 is when cancer is at its most advanced form. In this stage, the cancer cells have now spread to all lymph nodes and other parts of the body, which could include major organs like your lungs, brain, and bones. Ultimately, breast cancer is very invasive and can do severe damage. In the US, about 1 in 8 women will develop breast cancer in their lives. Precautions can always be taken and definitely should be.
Alright, so for my disease, I chose skin cancer. Skin cancer is the most common type of cancer in the United States, and it is estimated that 40 to 50% of Americans who live to age 65 will have it at least once. Skin cancer is mainly on the areas that are exposed to the sun, so like the head, the face, the arms, neck, hands, etc. However, skin cancer can occur anywhere and like spread within the body. The first sign of it is often the change in the size, shape, and color of an existing mole. And treatments for this is surgery is usually the standard method for skin cancers. And however, if the cancer spreads to other parts of the body, doctors may use other treatments such as chemotherapy, immunotherapy, and radiation therapy, or any other combination of these methods.
Hi, my name is Victoria Pavey and I will be discussing colon cancer. Colon cancer is a malignant tumor of the large intestine near the colon. Most cases of colon cancer are random. This means the individual person has a genetic mutation, but the other 5% are hereditary cases. Hereditary cases are when an individual inherits a genetic mutation from a parent. Most hereditary cases are found earlier than non-hereditary cases. Symptoms of colon cancer include fatigue, abdominal pain, diarrhea or constipation, weight loss, cramps, or bloating. The severity of these symptoms will depend on the size of the tumor. Treatments for colon cancer are chemotherapy. Chemo is a drug administered through injection or pill, and it kills cancer cells. There are 2 forms of chemo given. For advanced cancer, it is palliative chemo, which is given when it's advanced and aggressive, and adjuvant chemo, which is given after the cancer is surgically removed.
Hello, I'm Edgar Perez, and today I'm going to be talking about prostate cancer. Prostate cancer is one that only affects men and their prostate, which is a small gland that produces their seminal fluid. This cancer is one of the most common in the United States. Every year, there's about 3 million cases in the United States alone. In addition to this, studies show that 1 in every 6 men will develop prostate cancer after the age of 40. Also, if a family member has had this before, you have a really high risk of getting prostate cancer as well. Other ways that you could get cancer is if you have a high-fat diet or you don't do enough exercise. And some symptoms that you may have would be problem with urination, problems with sexual function, and you may also have blood in your urine. There are ways to detect prostate cancer. 2 of them are prostate-specific antigen, or PSA, or by the digital rectal examination. Those 2 can tell you if you have prostate cancer. Doctors are working on ways to help cure prostate cancer. Some ways that they cure cancer would be by doing a surgery on your prostate, as well as doing radiation therapy. Hopefully with this, prostate cancer can eventually go away and we can live